The North of 40 Club is now open. We're redefining and simplifying health after 40. If you've found yourself frustrated, confused, and overwhelmed by the nonstop Google searches and coming up empty handed, if you're confused and frustrated by the contradicting information, join us in the club where we have a community to discuss things with your symptoms with. We've got a growing library of Pilates and yoga videos that you can have access to 24/7, monthly masterclasses to teach you about what WTF is going on with your body, plus a monthly Q&A where you can come in with questions and get straight answers to your questions minus the Google searches. Book clubs where we recommend books monthly and discuss it based on what your needs are, what stands out to you. Community of like-minded women to support you through all of this. And nonstop resources and discounts to wellness tools, applications, and everything you need going forward as we age north of 40. Plus, it has to be fun. So we've got games and prizes and giveaways for everyone's participation and excitement within the club. This is only $33 a month right now. So I would hop in. You get a 7-day free trial to pop in, check it out, see if you like it, see if it works for you. On top of that, you will be learning as I learn, because as I go through my naturopathic doctor program, I will be sharing what I learn as it relates to longevity for women north of 40, to our brain health, and to our hormones, which are all huge and important factors. So join us in the North of 40 Club. Find the link below or find it on the website, nataliesayeswtf.com. Hello, and welcome to another episode of WTF Happened to My Body. I am your host, Natalie Garay, and we are in episode 3 of 6, talking about the sections of my upcoming book. It will be published and available on all major online bookstore platforms on January 28th, 2025. And this has been quite the process to get it here. And I talk all about it in the first episode of this series, but I will repeat it over and over again. This is the guidebook that you should have received when you left the hospital, when you left the birth center, when you had kids, but the good news is no matter how long ago it was, you can still use this book, because I have the 40 plus woman in mind when I wrote this book. So I won't go back into all of those details, but it is now available on the 28th. Pre-order is available. If you're listening to this before then, you can sign up on my website and get special access to those who are on the wait list. I'm also hosting a free Q&A session for everybody who purchases the book. That is going to be on January 29th at 4:30 p.m. Pacific time. So if you have purchased the book, email me at WTF@nataliesayeswtf.com, and you can join us live. And if it is past that date, email me anyway. We'll make up another one. We'll do another one probably the following month. But there's always things going on, so you just want to hop on the wait list anyway. So in this episode, we're going to talk about C-section and how a C-section is a major fucking surgery, and it needs to be rehabilitated as such. And I've said this over and over again. It is probably one of the main reasons why I wrote this book, but I had 2 C-sections. One was an emergency C-section after having spent 2 months on bed rest with my twin daughters. They were still born a month early, but I went in September. Their due date was mid-December, and I went in for a routine ultrasound to check on them. And the doctor looked at me and said, "Do you feel that?" And I said, "Feel what?" And he said, "You're contracting," or she, I should say, sorry, she. I'm forgetting her name at the moment. "You are contracting and we need to admit you." I didn't have shit with me. I didn't pack anything. I was up there. I knew they considered me high risk because of twins, multiple babies, but I did not expect to be admitted into the hospital that day. I was contracting, and of course, if I continued to contract, then I would have gone into labor, and these little nuggets were way too tiny
to come out of my body at that point. And so I went on bed rest for 2 months. And that first few weeks were horrific. Those first few weeks were ridiculous. They had me on all kinds of shit. Magnesium for one, I think to stop the contractions. Immediately gave the girls something to help support their lung growth because their lungs were not developed, and I believe are the last to develop in babies, especially I feel like there was something about female babies' lungs not being developed as soon as male babies, but I'd have to double fact check that one. And so I laid in this bed for 2 months, and they gave me a bedpan, and they had me hooked up on IVs, and every so many days, 5 or so days, they switched out my IV, which was terrible because 1, I hate needles. 2, it hurt like a bitch. I still have marks on my arms from the scabs or scars. I have scars on my arms from it. And they wanted me to piss in a bedpan. And I was pretty good size. I don't know if I was huge at that point, but I got huge laying there those final 2 months. And I was like, I can't lift my ass over this thing because I would put it on my bed and try to hoist myself up over it. So eventually, after some time, I don't remember the amount of time, but after some time, I refused the IV. And I said, before that though, I was like, I'm not using this bedpan, so I'm taking my IV with me. So you're going to have to, make it mobile, which it was, and they did. And so I called it my dance partner. And every time I had to use the bathroom, my IV, stand came with me. And then, like I said, eventually I ended up refusing the IV because it hurt. And I was like, at this point, if they come, they come. I guess it was for emergency purposes. If they had to shoot me up with something all of a sudden, that was what the IV was for. But, I went in early-ish September. I just remember it being right around the time of baseball World Series. And so I would do things in the morning, like, I don't know, read, or family would stop by. My parents lived 3 hours away, but they would still periodically come in. They would bring me snacks, bring me outside food. I had dear friends who would pop in and read to me or hang out and play cards. And my dad would come in and play cards with me. And I remember one time just being in the middle of a card game and passing out, falling asleep because the magnesium just was so bad. It just made me tired and it did not make me feel good. And I'd wake up and we'd be in the middle of a card game and he'd just be sitting there patiently, just waiting for me to wake my ass up. So laying there for 2 months, not doing a whole hell of a lot, I just became atrophied, and which was wild because, I was relatively young. I was 26 and relatively strong because I was a dancer. I spent my time prior to that dancing. I danced in studio classes until my 7th month, taking ballet classes, I think maybe even some hip hop classes. And that time sitting on my ass, oh, speaking of ass, my ass was so flat when I came out of that. After my time was up there, my ass was so flat, on top of being unable to get out of the bed unassisted or being able to stand up upright without hunching over with a humpback. It was really bad, but, I spent my days in bed. The World Series, that's what I was talking about. I would watch the World Series during the day, but otherwise turning on the TV was depressing because you know how those cable or non-cable daytime TV shows, or at least 20 something years ago, they were so depressing. And that was until November, and that was a Monday. And I remember my favorite nurses going home for the weekend and saying, I'm off on Monday because it's a holiday, don't go into labor. Well, I did. I started to go into labor, and still the girls were so tiny, too tiny to be delivered vaginally. So I went in for an emergency C-section because the medicine that they gave me to try to stop these contractions didn't work. So I went in and they, put the needle into my spine to numb me from the waist down, and they tied me down with my arms out into a T. They put a curtain up between me, my lower half, and my upper half. Gave me something for anti-nausea to prevent me from vomiting, which I immediately vomited up. And then I had a C-section. And I remember to get super graphic. So warning, I remember smelling the skin that they were burning through to get through before they cut. Before they cut through the uterus and to get the babies out. And I could feel it somewhat, just a little bit of the tugging. But I remember going after we were released from the hospital, which I was there for another 5 days after my C-section. I was released with twin A, with my little Nia, but Kea was 3 ounces, and so she had to stay until she was over 5 pounds. Nia was about 5 pounds, 9 ounces, so she came home with me. But at some point after that, I was intrigued by my stay there and I wanted all the details. And I ordered my hospital report, which was well over, 200, 300 pages. And I read through it, and I read through the operation process and how they went through the skin, cut through the uterus, rolled the and the muscles. I forgot the muscle layer. How do I forget the muscle layer? Because that's all I talk about is re-strengthening your abdominals. Cutting through the abdominals, rolling them back, clipping them, and then, making their way to the babies. And when I looked at that, and it wasn't until years later going through my Pilates training and practicing Pilates that I realized, whoa, like this is a really major surgery. So why are we kicked out of the hospital, 3 to 5 days later without a prescription for physical therapy? Every other surgery requires physical therapy. I could be wrong, but I'm pretty sure maybe even a sprained ankle requires or you get a prescription for physical therapy. So why not a major abdominal surgery that basically practically severs you in half and goes through all your major muscles that keep you upright? Are we not given a prescription for physical therapy? I'm going to go ahead and chalk that up too because it's a woman. But the good news is that I was able to rehabilitate, re-strengthen my abdominals. I was able to help other women do the same thing in my Pilates studio, which was one of the main reasons I opened my Pilates studio in 2015, was specifically for women who had kids and had pregnancy and birth-related symptoms without answers. And I knew that because I had experienced being able to strengthen my body and re-strengthen my body and rehabilitate with Pilates, that I could support women in doing the same thing. And so that was my sole purpose for those 5 years of having my studio up until 2020 when it closed down. And then I moved my practice online entirely, which I had already done back in 2012 upon moving out of LA. So I was familiar with the online world and being able to support clients through video. I think at the time I was using Skype. Anyone remember Skype? I used Skype, and then was there something else? I don't remember, but Zoom was amazing for it when, we all started using it in 2020. And the thing is people were kind of skeptical, I think, at first when I was teaching on Skype, but having been able to work with women for so long in person and just having, a deep knowledge of the anatomy and how the muscles work, I could see things that people were kind of surprised that I could see. In the book, I break it down again as far as the muscle groups that we're using that were which were likely, cut or used during cut through during a C-section. Which, by the way, I met up with an OBGYN when I had my studio in San Luis Obispo County, and I met because he had heard about my rehabilitative work and he wanted to learn more so that he could refer his patients to, or he did any sort of surgeries on them, which I thought was fascinating and fantastic. And I mentioned that in the book as well. But at that time, what he mentioned to me was that doctors were now trying to do a less invasive surgery for C-section. And he mentioned that rather than cutting through the lower abdominals and rolling the abdominals up, they were now separating the rectus abdominis and going down the middle. So pulling them apart in order to get to the baby as opposed to cutting the abs, which I could see the reasoning behind it. But to me, and we're in the next episode, I'm going to talk about diastasis recti. I also know that that is not something that you want to experience either, having that abdominal wall separation, because it weakens the strength of your core, your abdominals, and your overall strength and foundation. My assumption is that they stitch that back up, but what I've heard from clients who've had that done, it does the job with stitching it together. But I think that there's other issues with that as far as pain and tight abdominals, and not in the best way. So I was a little, I got the gist of why they were doing it, but I was a little concerned as well about that, because I saw women in the studio. I still see women who experience this. And the main concern for most women who have an abdominal wall separation is that they will sometimes months, years later, look 3 months pregnant or more. And it sets a toll. It takes a toll on their confidence. And I completely understand that. And as a Pilates instructor, my concern is more so your body not operating optimally functioning as a full unit, as a full strong foundation, because they are now weak. So in the book, I also break down your quick start list of exercises that can support you with strengthening your abdominals slowly, because you will be surprised at how these exercises are very simple but effective. And so when you do them properly and consistently, you will see the benefits of it. So that I break down in the book, the exercises for you to practice on a consistent basis. And if you find that looking at these exercises, reading through them, you're still unsure of how to do them, because there aren't pictures of the exercises in the book, unfortunately, but what I do have are videos. And for me, that's the easier way to learn and to practice it, is just to watch a video of it. But I wanted to have the exercises listed in the book, and I wanted to have the directions on how to do the exercises in case you, didn't have access to the videos, or, for whatever reason, they're there. So you have them. I didn't even know what these exercises are, but you can find a couple of them for free on my YouTube channel. I also have a Pilates and yoga video library within my North of 40 club, which you will have free access to try it out and poke around and see if it's something that would interest you and support you on your strengthening and rehabilitative journey. So this episode, like I said, is about C-section, a major fucking surgery. If you had one or two C like I did, and you're feeling the effects of it, the effects of weakened abdominals from it, they may look something like poor posture. Maybe your shoulders are rounded, your neck juts forward. Maybe you have chronic hip pain, neck pain, lower back pain. Maybe you do have a bit of a pooch that is not comfortable for you because of the C-section. And so I would encourage you to try these exercises. I would encourage you to incorporate some stretches and movement. The other things I offer as suggestions in the book are massaging the scar area, massaging your abdominals, because what I heard from a lot of my clients too is that they would feel occasional twinges. And it is possible that the scar will start to, or has formed, adhesions. And these adhesions could potentially attach themselves to organs and things internally. Sorry about my damn dog. That could be the cause for your twinges and periodic little aches and pains. So massaging your scar area could help break up these adhesions. There's more tips in the book, and I will link it here if you are listening to this after January 28th. It is available on all online platforms. You can find it on Amazon, Barnes & Noble. You can also find it on my website, nataliesayeswtf.com. If you have questions or want to message me directly, I am available on Instagram at nataliesayeswtf. I'm always happy to answer questions, offer resources, any support that I can there. So feel free to reach out. I appreciate you being here. Thank you for listening. And if you're interested in the next episode, come on, over, we were talking about diastasis recti, the abdominal wall separation.